right, have you been following this? Jay Leno has had surgery for his burn injuries and is expected to have another surgery later this week, according to the doctors who are treating him in Los Angeles. They do tell us that some of the burns on his face are pretty serious.
It's a little too early to tell right now. We're hoping to get him as close to the pre-injury status as we can, but his injuries are serious. There may be some long-term marks that you'll see. At this point in time, though, it's just a little bit too early to know.
And that was actually video of him this week. Leno was working on a car over the weekend when he was burned in a gasoline fire. Joining me now is emergency room physician, Dr. Leigh Vinocur. Doctor, thank you so much for speaking with us. I know that you've certainly treated many burn patients in the ER. I really want to talk about this hyperbaric chamber that they've been putting him in. And certainly we don't have an exact timeline if it was used before or after, but we know that it's being used in his treatment. Why?
So hyperbaric oxygen is at high pressure. That's how it works, and it increases the oxygen. It's used for a lot of different wound healing, severe infections too. So with burns, the hope is to increase the amount of oxygen, because as you increase the pressure, you're increasing the amount of oxygen, and that will help with the wound healing. And it's used in different conditions, but burns too, because you want to get more oxygen to the area so that it can get more nutrients and it can heal better. And especially with his burns, which are severe, third degree or full thickness burns.
Yeah, you know, I was reading some articles online, and I'm curious about the potential damage when we talk about second and third degree burns on the face. And certainly we don't know the nuances and the locations, but that sounds really serious.
It is, and the hands are very serious too. So what a third degree burn is, first, second, third, they're mostly called partial thickness and full thickness now. But a full thickness burn means it goes through the epidermis, the outside layer, but it also burns deeper into the dermis. And the lower layer of the skin is this part of the skin that regenerates. So any burn into the dermis, your skin is not going to be able to regenerate. So those burns need skin grafts, and they are serious. And depending how deep it goes, it can damage nerves and blood vessels and things like that. So there's a potential, even with the skin grafts, for serious scarring and contractures from the scarring. And that's why the hands are critical, because you need function in the hands and movement in the face. So they're serious burns.
I mean, not only that, it just sounds so painful to me when we talk about these burns on your hands and your face. Treatment, I assume, would take some time, but will he be able to sort of restore his appearances?
Well, that depends. And you know what's interesting is that actually third degree burns, if they burn through the muscle, they're not, the nerves, they're not painful. So that's a bad sign. I do believe that they said that a lot of the nerves were spared. So it's maybe not quite as deep, but you're right, it takes a long time, and there can be permanent scarring. And what you want to ensure, especially in functional things like the hand that you need to use, is that the scarring doesn't contract up and cause contractures. So that it's going to also take a lot of physical therapy of his hands and such, and movement of his face, even after the skin grafts heal.
Wow. All right, Dr. Leigh Vinocur, thank you so much for joining us. We really appreciate it, some of your expertise there.